Yes, we have lots of people who are already joining us. Hello, everyone. I am Suzanne Sobers, and I am the Director for Volunteer Engagement at the Marfan Foundation. And joining me today is my colleague, Bruno De Silva, and Bruno will be posting in the chat box. Bruno, just wait for everyone. He did. So welcome to the third and final week of our International E3 Summit. And it's all about educating, empowering, and enriching our community. And it is brought to you by the Marfan Foundation and its divisions, the Lewis Dietz Syndrome Foundation and the BEDS Movement, as well as our partners in Europe at VASCERD. We want to thank you for making this truly a historic event for us. It's by far the largest event that we've ever had, with almost 2,800 people registered, representing 72 countries. So we are so excited. We hope you took the opportunity to connect with others in the Hoover app from all over the world. And we want you to know that you are not alone. So it's so important to make that connection and get the support of others. So please, if you have not already connected with others, please do so. We are very grateful to our presenting sponsors, Brigham and Women's Hospital and American Communication Construction. Now, before we begin the presentation, we have a little bit of housekeeping. We want you to know that this International E3 Summit is a forum to provide an open discussion of issues related to genetic, aortic, and vascular conditions. And the opinions of our speakers are not necessarily those of the Marfan Foundation or VASCERD. So if any differences of opinion, you hear differences of opinion from our speakers and you want further clarification, please contact our help center at marfan.org/E3S. Now remember, the volume is very high at this time, so please give us a little time, be a little patient, and we promise to get back to you as quickly as possible. Now tonight, we are fortunate to have someone from our community, Sarah Schroeder, and Sarah will be speaking on coping with medical trauma. But before we move on to the presentation, we just want to remind you how important it is for you to rate the session when it is over and also to give your feedback. Only with your feedback can we build programs that are meaningful to you. So we ask that you complete the survey. And what's really exciting about the survey is that we will randomly pick 3 people who have completed the survey, and we will offer them a $50 international debit card. But you must complete the survey, and you need to do it before 11 p.m. Eastern on Wednesday, September 16th, in order to be eligible for that $50. So again, 3 lucky attendees will get a $50 debit card. Now, following the presentation, there will be plenty of time for question and answer. And Sarah really wanted us to have a great discussion, so we don't have a long presentation, but lots of time for questions and answers and great discussion. So without further ado, we are going to begin the presentation, and when we come back at the other end, we will have a great discussion with Sarah Schroeder. So here's the presentation. I don't hear anything on the presentation.
Or one of many other things. And it is considered a trauma regardless of if this upsetting event, such as the surgery, happened to you or if it happened to a loved one that is close to you in your life. And then looking at what is PTSD, it stands for post-traumatic stress disorder. And so an easy way to remember what that means is to remember that the P stands for post, meaning after. The T stands for traumatic, which is an upsetting life or death event like I described on the previous slide. The S stands for stress, which is your body's alarm system. And the D stands for disorder, which is something that gets in the way of your life. So altogether, PTSD is after an upsetting life or death event, your body's alarm system gets in the way of your life. What makes it hard to cope sometimes is that alarm system in your body is confused. It might not know, you might not be able to recognize what is dangerous and what isn't, and your brain and body need to relearn that. Some things that are not dangerous at all or are different situations may trigger that alarm system, so that's what needs to be learned. And strong feelings are associated with this as well, like fear, worry, anger, sadness, or guilt, or any number of other feelings that I didn't list. And so that can add to the challenge at times.
Okay, so we are going to start the video all over because we had a few raised hands that there was no song at the beginning, so please forgive us for that. So we will start the video over.
Hi, I am Sarah Schroeder. I am a mental health professional living in Minnesota, and today I will talk about mental fortitude. I'm also a member of this community as I myself have vascular Ehlers-Danlos syndrome. The first thing that I'll talk about is a little bit about trauma. So what is trauma? It is exposure to actual or threatened death, serious injury, or sexual violence. Medical trauma might include a major procedure or surgery, a life-threatening diagnosis, a lengthy hospital stay, or one of many other things. And it is considered a trauma regardless of if this upsetting event, such as the surgery, happened to you or if it happened to a loved one that is close to you in your life. And then looking at what is PTSD, it stands for post-traumatic stress disorder. And so an easy way to remember what that means is to remember that the P stands for post, meaning after. The T stands for traumatic, which is an upsetting life or death event like I described on the previous slide. The S stands for stress, which is your body's alarm system. And the D stands for disorder, which is something that gets in the way of your life. So altogether, PTSD is after an upsetting life or death event, your body's alarm system gets in the way of your life. What makes it hard to cope sometimes is that alarm system in your body is confused. It might not know, you might not be able to recognize what is dangerous and what isn't, and your brain and body need to relearn that. Some things that are not dangerous at all or are different situations may trigger that alarm system, so that's what needs to be learned. And strong feelings are associated with this as well, like fear, worry, anger, sadness, or guilt, or any number of other feelings that I didn't list. And so that can add to the challenge at times. There are a lot of ways to cope. I just have a few ideas here on this slide. The first one is to use some grounding exercises, and I just have one example here, but what grounding exercises do are just help you to clear your head and feel grounded in where you're at the moment. This particular exercise, you can remember it just by counting backwards, 5, 4, 3, 2, and 1. And as I read through it, I will go ahead and do that exercise for myself too, so you see kind of how it happens. And if you want to listen along and do the same exercise in your head, you can certainly do that. So naming 5 things that you see. So as I'm looking around, I see my computer that I'm looking at the PowerPoint on. I see a notebook. I see a stack of papers. I have a window so I can see the trees outside, and I see that I have a light on in my room. Then thinking of 4 things that you can touch. So one thing for me, I have my hand resting on my knee. I'm holding a pen in my other hand. If I touch my computer, it feels cool. And if I touch my paper, it kind of has that crinkly feeling to it. Then 3 things that you hear. So as I'm listening, I hear my dogs barking outside. I hear there's a little rain. I hear the rain hitting the side of my house. I hear the air going through the vents of my house. And then 2 things that I smell. I can smell the fresh air from the rain, and I can smell some food cooking in my kitchen in the crock pot. And one thing that you taste. One thing I taste is like the mintiness from a piece of gum that I had earlier. So that type of activity just kind of helps you clear your head and calm yourself and focus yourself. Another way to cope is to use positive self-talk. I like self-affirmations, thinking to yourself things like, I'm a survivor, I have hope, and you can use those in place of when negative thoughts come into your head too, kind of feeling hopeless. You can remind yourself that you do have hope and you have achieved a lot of things, and there are more things that you can achieve going forward. And then a third coping strategy is just to do enjoyable activities. So maybe you have hobbies like gardening or photography, physical activities like walking or swimming, or maybe you're involved in some community groups like a church or classes. And when it comes to some of those hobbies or activities, just make sure to run them by your doctor to make sure that they are safe for you to do within your diagnosis. And then ways to adjust. One way to adjust that I personally have found really helpful with my VEDS diagnosis is to connect with other people who understand, who might have family members with a similar diagnosis or situations. And one way you're already doing this is by attending this summit, also attending conferences or being involved in support groups, either through social media or face-to-face. Another way to adjust is connecting with a therapist. You've been through trauma, and there is something that can help you with that as far as learning how to use some coping skills or figuring out what might work best for you. And then the last way that I'm raising to adjust is to use a self-care app on your phone or tablet. there are so many different apps out there that can help you focus on ways to care for yourself and stay mentally and physically healthy. I just have a few examples listed here. There are Headspace, Calm, Happify, Shine, Pacifica, and again, there are others as well. Most of the apps tend to have some features that are free and then some features that are paid. And so I recommend maybe downloading a few of them and checking out the free features first before deciding whether you might want to invest in the cost of one of them. And that is everything I have on mental fortitude for today. I can answer any questions or respond to comments, or I'd be happy to hear some strategies that you use for coping and for maintaining mental fortitude.
Thank you so much, Sarah. That was very, very insightful. And we do have quite a number of questions in our Hoover app, and we want to encourage you to continue to put your questions in the app. And the first one is, what are the best self-help methods for dealing with post-surgery ICU PTSD? Can you self-apply EMDR?
Yeah, that's a great question. Are you hearing me okay?
Yes.
Okay, great. Some of the things that I mentioned in the PowerPoint are great for self-help, for self-care, such as the grounding, or also known as mindfulness activities, finding an app that works well for you, that can encourage you to use some of those skills or strategies when you're feeling stressed or overwhelmed. Also finding some of those positive, enjoyable activities to do, connecting with your community of other people with similar experiences and similar diagnosis. Using that positive self-talk, reframing some of those negative or fearful thoughts into positive ones. And then you asked about EMDR. EMDR it stands for eye movement desensitization and reprocessing. So that's why we call it EMDR. It's a long one, but it is a studied and evidence-based treatment for PTSD, for post-traumatic stress disorder. So that just means that it is effective for people with that diagnosis. To my knowledge, I don't believe it's something that you can self-apply or administer to yourself, but there are clinicians and therapists out there who are fully trained in administering EMDR. If you go to the official website, it's just EMDR.com. There's a button that you can click on there that says find a clinician, and those are, you can search by name or by location, and those people would be the ones that are trained to administer EMDR. You can also, if you have, say, a local mental health therapy office that you're interested in visiting, you could certainly go ahead and call and ask if anyone there is trained or is using EMDR or similar therapies. Sometimes they're not always listed on the official website, so that's something you could check on as well. And there's some other evidence-based studied therapies for PTSD out there too. So if EMDR doesn't interest you, or it feels like it's not going to be a good fit, some other things that you could look at or are cognitive behavioral therapy, or also known as CBT. There's cognitive processing therapy, or CPT. There's exposure therapy, and then there's also medication. So there are a lot of options out there as far as just doing your self-care, self-help at home, and then seeking professional help.
Okay, great. Thank you so much, Sarah, for that one. Here's another great question. I'd like to hear ideas for dealing with multiple simultaneous traumatic events or with a rolling series of events like multiple surgeries?
Yeah, that's a great question. And I think a lot of us, myself included, have been through multiple traumatic events or multiple stressful events when we're dealing with physical health conditions. And then there's also just other things in life that we may have experienced that could be traumatic. Some professionals call that complex PTSD or CPTSD, and that's just recognizing that having those rolling events or multiple events might be stressful in a different way or might cause you different symptoms than someone who's just had a single traumatic event. The interventions that I just talked about, such as EMDR or CBT, are still effective interventions for the complex PTSD or complex trauma. It just might take a little more time to treat, or as you're coming in and out of major events, you might need a little bit of a booster with a therapist or just some extra support, or you might end up needing multiple strategies such as therapy and medication, or adding in support groups and therapy, or just kind of a combination of things. So multiple traumatic events are definitely treatable as well. It just might take a little bit different approach than someone who had just had one event.
Okay, and you can imagine that it's probably very applicable in our community, because many in our community have had multiple surgeries or that sort of stuff. So thank you so much for that, Director. How do you deal when you have been wrongly diagnosed several times? How to trust professionals again?
Yeah, that's a good question as well, because I think that's another common thing in this community. I know it was for me. I had some health concerns for years before I got the VEDS diagnosis. So I've been there to some degree, and I think that's a common thing for a lot of people when you're trying to tease apart symptoms and your doctors aren't really sure, or you have doctors with different opinions. So we see that. To some degree, it just takes time to rebuild that trust and to find professionals that you can trust. There are so many health conditions and diagnoses out there that some doctors just don't have all the information on everything, and that's just a reality that we deal with. So one piece is going to be finding a doctor that that does understand you, and then that you can gain the trust with, and a doctor that understands your diagnosis, maybe connecting with doctors recommended by other people who have the Marfan or other diagnosis, someone that's recommended within the community. And then as you encounter other doctors or specialists in your journey, that person, you can recommend that person potentially connect with the professional that has some knowledge on your diagnosis. And you can bring information to new doctors too, and kind of talk with them and say like, hey, I just want you to know, like, this is what I've been through. It's been a long road. Here's some information on my diagnosis. Are you willing to work with me? I think most doctors are. But if you get a doctor who's not, or who you feel like you're really struggling to connect with, it's okay to seek another opinion or to look elsewhere for a different doctor.
Great, and I think that's why it's so important to make that connection in our community with others, and also working with the foundation through our help desk, because there's so many resources that are available to our community. Just reach out to us. We can connect you with doctors, providers, some centers of excellence, and so forth. So you're really not alone, as I stated in the very opening. Okay, so this is a tricky one. Coping with the loss of a child with neonatal Marfan's. Due to its rarity, it's hard for others to understand the journey you've been through prior to the loss, in addition to the loss itself.
Okay. Yeah, that's a complicated situation because like the person stated in the question, it's multiple losses. So maybe you're experiencing, the diagnosis and trying to deal with that, and then you end up losing the child, and I don't think there is no grief that can compare to that. So on one hand, just understanding for yourself that that's a really big loss, and it's clearly going to have a grief process. And yeah, people who have or haven't been through it are not going to fully understand. But again, I would recommend just looking for support within the community. So here with the other people who are attending the summit, or reaching out to the help desk or helpline through the Marvin Foundation to find resources or groups or people that can be the most supportive and most understanding. It would make sense to engage in some mental health therapy to work through the loss, and potentially find a therapist who understands trauma and medical trauma. And then again, kind of providing information about the diagnosis and about the situation you've been through with people that you're close to, and that might be other doctors or professionals, that might be family or friends. I think the people that you're closest to, even if they don't understand, they want to be there for you. So being able to provide some of that information to let them have some understanding would be helpful.
Great, thank you. Another great question. My trauma is not as serious as others' trauma. We love to measure a level of trauma. Why am I still struggling so much?
Yeah, that's a good question too. And I'll just say right off the top that trauma is trauma. So there's no judging or rating, like my trauma is worse and your trauma is not that bad and that other person's is the worst. It really, it just is how you're experiencing it. And, that's something that you can keep in your head too. Like my experience or my trauma is my own. I don't have to compare it to anyone else. And your journey to healing is going to be your own too. So regardless of if you think it's not as serious, every trauma is going to take time to heal from, and every trauma is as serious as it is for that individual person. So I think just thinking about that, not having to judge your level of trauma, but just look at what you need to move forward and giving yourself the time to do that. And everyone experiences things differently, so that's completely normal.
Okay, thanks, Sarah. Okay, I have trauma, but not PTSD.
Can you have trauma but not PTSD?
Mm-hmm.
Yeah, absolutely. A lot of people have been through traumatic experiences. Like the slide said, a traumatic experience is like a life or death event that happened to you or someone that you're very close to, such as, like a surgery or a medical emergency, and among other things as well. But some people experience the trauma and it doesn't turn into PTSD, post-traumatic stress disorder, for them. That person might have some post-traumatic symptoms, or they might integrate that trauma and not have any symptoms, and that's okay too. Like I said in the previous question, everyone kind of experiences things differently, and that's okay. So yeah, you could be having trauma and not necessarily have PTSD.
Okay. I don't think I have PTSD, but I'm dealing with anxiety and depression. Is this normal?
Yeah, I would say that's normal too. Again, it's something that everyone experiences differently. So maybe you've been through traumatic events, or maybe you haven't. Regardless, you could be experiencing some degree of depression or depressed mood or anxiety. It could be related to a medical trauma. It could be related to a different trauma, like say a car accident, or it could be unrelated. You know, some people are simply prone to anxiety or depression or other mental health needs, and that's completely normal. The important part is recognizing the types of symptoms you're dealing with, and deciding how you want to address that, whether it's interfering with your day-to-day life, if you can address it with some self-help or self-care skills, or if you want to seek out a professional. But yeah, I would say that's very common and normal.
Another great one, Sarah. Medical trauma has left me with a debilitating fear of pain. What are some ways to cope with a trauma response that isn't based in anxious thoughts, but is an immediate and innate bodily response?
Yeah, that's a good question. And in some ways it relates to on that one of the slides I had gone over that definition of post-traumatic stress. And so it's your body's alarm system responding to something when it doesn't always have to. So, you know, your brain is kind of mixing up that stress response. And like you said, some things are, for some people, it's related around anxious thoughts, like, you know, what's going to happen when I go to the doctor? I don't want to go. And then you're having to learn to think about that differently. And so you said yours is in response to physical pain. And in a lot of ways, that's actually similar, because it's also just an automatic brain response. You can retrain yourself to some degree with just giving yourself some self-talk or some kind of mental scripts surrounding pain. So when you do have that physical pain, like say it's a minor ache or pain, or like a pulled muscle or a headache or something like that, you might make a script for yourself that you just kind of tell yourself, this is a small amount of pain. I'm okay. I've had headaches before and I've been fine. If it gets to a certain level, then I will contact my doctor. Or if it's as a result of a trauma like a car accident or a fall, then I will visit a doctor. So kind of making a mental plan for yourself. So when you do experience that pain, you kind of have a plan in mind rather than kind of letting it spiral out of control. And again, you may need to seek out some intervention with a therapist too, who can also work with you on responses to that situation.
And sort of along the same line, because the question is, how do we train our bodies to not immediately see everything as being dangerous?
Yeah, that is kind of similar. And again, that is a very common response to trauma and a very common symptom in PTSD. So we see that a lot. So that is, I don't know, sometimes it helps just to know, like, okay, that's expected or normal. And some ways of retraining your body are doing things like calming breathing exercises and grounding activities, like the 5, 4, 3, 2, 1 activity that I had gone over, or some people use mindfulness activities, which are similar, that also help calm your brain and calm your senses at the same time. So that can kind of help you slow down that automatic response. But it takes time too. That is something it kind of happens without you even thinking about it, and your brain just kind of goes there, and your body just goes there. And, you know, it takes some time to start to recognize that about yourself and know when it happens and put some of those skills into place.
Okay, so you sort of touched on mindfulness before as you were helping us with that last question. So the question is, I've heard mindfulness is a good strategy, and what do you think? What are your thoughts on mindfulness?
Yeah, I think mindfulness is a great strategy as well. Like I was just talking about in that previous question, you know, it's a nice strategy for slowing down your body when you're having those automatic responses, or if you're having kind of a panic response. Mindfulness skills can help slow you down. So there was that example that I gave, but there are many, many, many mindfulness strategies out there. So if that example you didn't care for, or you feel like it didn't really work for you, there are a lot of activities that you can find, for example, through the Calm app or some of those other apps. There are videos on YouTube that if you were to search like mindfulness for pain, mindfulness for trauma, lots of options out there. There are also books on mindfulness that you can check out from the library or order. And then if you do have a therapist that you're working with, that person would be able to provide you with some options as well. So yeah, it's a good strategy.
Okay, so that leads actually into a great question. How can I find a good therapist?
Yeah, that's a good question too. There are so many different things that people are dealing with when it comes to mental health. And so you want to find someone who understands your condition. So for example, if you do feel like you have some symptoms of PTSD, or if you've had a PTSD diagnosis, or you've just been through some traumatic events, you might want to talk to other people, again, in the community, the Marfan community, who can recommend therapists to you, or who have someone that they have worked with and enjoyed working with, or felt like it went well. So that's one way. If you're wanting to find someone local to you, you could certainly check with friends, neighbors, people in the community with to find out, you know, if there are certain therapists that are recommended or that others have had positive experiences with. There are also there are ways to do therapy through online, like through your phone or through therapy apps. And then with those, you can also research people who have dealt with trauma and who have dealt with people with medical diagnosis. So yeah, kind of keep your options open. I guess another option too is you can directly call you know, a local agency or counseling clinic, or even medical clinic. A lot of times they will have mental health professionals as well, who you can ask some questions and ask them who would be a good fit for you. And then the last piece too is if you do start with a therapist or start counseling and you find like, oh, it's just not a good fit, I'm really struggling connecting with this person, you could always talk with them about it, or you can always request someone else too. That's perfectly acceptable and okay, and people do it.
Okay, great. Close friend thinks PTSD is just something that happens to veterans. How do I explain my experience?
Yeah, that's a good question, because when PTSD became kind of known in our culture, I think it initially was diagnosed in veterans for the most part, who had been, you know, in active duty or experienced those types of war or combat related traumatic events. So I think some people still have that in their heads, that that's what PTSD is about. So it's just kind of letting them, if it's a person that is close with you, like a friend or a family member, I would guess they would be open to hearing from you. So letting them know, okay, actually other situations that I've experienced are traumatic as well. There's a lot more information out there about PTSD now, and yeah, just letting you know, like, hey, these other experiences can also lead to PTSD. You might provide some information on what PTSD is or what medical trauma is, even from information from this talk, and just, yeah, kind of provide more information and also be willing maybe to answer their questions about it too. Most people, if it's someone that you're close with and someone that you care about, they would want to be able to learn and understand.
Yes, indeed. They want to support you, so they want to
Yeah.
understand what you're going through. Thank you for that. Someone says, I don't really like self-affirmations. They feel weird and cheesy. What can I do instead?
Yeah, that's a good comment too. I think every strategy isn't for everyone. So some of those affirmations might feel weird or uncomfortable, or you think like, that's not how I talk. So one thought is, if it's a phrase like what I had mentioned in my, I don't remember what I said, but like, I'm strong, or I can do this, or I'm a survivor. Some of those phrases, if they don't feel right or they don't feel like something you would say, you can definitely think of something else, in the type of language that maybe you would use on a daily basis. So that's one way, is just kind of changing the language so it sounds like you, it sounds like your own voice. And then if it truly, like, if it just doesn't feel good or it's not helpful, that's okay too. You can use some of the other coping strategies that are out there, or just engage in positive activities, or do some of the mindfulness strategies. Some of those other things might just be a better fit for you.
Okay. Another great question. Oftentimes we think that by seeking help, it shows us as being weak. Can you elaborate on why this is not the case?
Yeah, that's a great question. And I think that's kind of culturally something that we see as like, oh, this person is weak, they need help, they must not be able to handle life, they don't, I know that's kind of seen in some cultural situations or some circles as true. And I guess I can say, as a mental health professional, it's far from true. For one thing, seeking out that help, I would say, is a strength, and it's a positive to be able to recognize, like, okay, I'm struggling with this area in my life, and if I get help, then I can move forward. And so recognizing that and being willing to seek it out really is a strength. And the other piece of it is, I don't know, I think it's just something that we need to relearn and kind of retrain ourselves to realize, like, everyone needs help in some way. And maybe some people don't need help for their mental health or trauma or physical health, but we rely on people for different things in life. And so that's just that's part of life, is getting help where we need it, so we can have the most kind of productive and successful lives that we can.
Yes, thank you so much. Another great question. When will I get over my trauma?
Yeah, that's a good question. And I wish I could give a clear-cut answer, like, okay, in X amount of time, then you'll be done with your trauma and you're just free of it. But unfortunately, that's not the case. It's different for everyone. If you're going through a therapy or treatment, that it might be, a few weeks or a few months, or it might be years, or it might be forever, and all of those are okay and acceptable. I've noticed for a lot of people, myself included, it's not as much about getting over trauma or forgetting about your trauma as it is kind of understanding or accepting, this is something I've experienced in life. I'm going to move through this trauma, or I'm going to move forward with my life. So maybe not completely getting over it or forgetting about it or swiping it from your memory, but just being able to move forward and kind of integrate it as, okay, this is something I've experienced in life.
Mm-hmm. You're right. Some things you just cannot erase from your memories. You just need to learn how to cope with it.
Yeah.
I'm going to combine two questions. So it's along the line of how do I support a partner, child, or friend who has experienced medical trauma? And I'm combining it with someone who is asking about the difficult teenage years and supporting their son who can no longer go to the pediatric A&E and now has to be seen at the adult level, but doesn't want to do that.
Okay. Yeah, that's a good question too. And it's, I don't know, it's relevant because we all go through, you know, different life transitions, and whether it is like those teenage years or, you know, later in life or moving toward like retirement or any of those major life changes that will affect how you handle your diagnosis and how you intervene with it. So when it comes to a family member, a partner, a child, or a close friend, some things that you can do are just like being there for them. So just being present, being willing to listen if they want to talk about it, or if they have questions, or if they just need to express or vent their stresses or concerns. And being there to listen without judging, or with sometimes even without giving advice or giving a recommendation. Sometimes people just want to express that the feelings or the stressful events, or you know, how it's affecting them, and just need to get that kind of off their chest or be able to express it out loud, and not always needing advice. Another way you can be there for them is kind of understanding, respecting that they might act differently, whether it's, you know, a trauma response symptom, or whether it's fear or anxiety about going to a new doctor or going to a different type of clinic. That's understandable that there's going to be that worry there, or there's going to be a fear there, or some sort of apprehension. So kind of understanding that piece as well. And then when it comes to, I think especially relevant when it's like a child or a teenager, or someone who maybe is not a grown adult where they're making all the decisions for themselves. Sometimes you can like accompany that person to appointments, or tell them about what the options are. So maybe if there are a couple of multiple options, just kind of giving them some choices, you know, working with that person on, if they do choose to not go to an appointment, what would the consequences maybe be. Just kind of being available, but not being too pushy at the same time, kind of having that balance.
Okay, great.
Yeah.
Two more questions, and this question is really a good one. I get nightmares. How can I stop them?
Yeah, that's a good question, and it's another common response to trauma that we see a lot are nightmares, and also some people maybe get like flashbacks or things like that too. But especially when it comes to nightmares, I would say one important piece would be to have a good like nighttime routine and good what I call sleep hygiene. So some ways to do that are to avoid eating right before bed, avoid caffeine near bedtime, avoiding screen time around bedtime, trying to go to bed at a similar time and wake up at a similar time daily. And if you want to learn more about sleep hygiene, you could certainly look up ideas or talk with your doctor about that too. But so setting kind of a good routine around sleeping, but sometimes nightmares still happen. So there are medications out there that do help with sleep and with reducing nightmares. So that's something that you could talk with your doctor about. And then usually doing some therapy as an intervention too. So as you are working through therapy for a trauma, typically the further you get along, the more symptoms will start to reduce. So if nightmares is one of your symptoms, that will reduce over time. Likewise with things like flashbacks or panic or those sorts of things. So also giving yourself time, that's another one where I wish I could say, okay, do this or that and the nightmares will disappear. But usually it takes some time too.
Okay, so I think it's a perfect segue to the last question. This person says, thanks for the grounding exercises. How often should I do it as my fears of my issues is constant? So they're constantly fear. How often should they use this grounding exercise?
Yeah, that's a good question, and that a good point too, that sometimes that fear is just there all the time, and it's not that you can do it every time you start to get the fear because it's always there. I would say there's not a perfect amount or a perfect frequency or a perfect activity that works for everyone, but it would make sense to maybe work it into your routine. So if you're doing like a sleep hygiene routine, that might be a good one to do right before you go to bed. And likewise, possibly right when you wake up in the morning to kind of set yourself for the day to help you be grounded moving into the day. Otherwise, it's for some people, it's worthwhile to look at what parts of the day are the highest fear or the highest stress level for you, and then using those skills like right before that situation or right after it. Sometimes you might not know. I know you said, I'm feeling this all day long. So sometimes it works to just kind of keep track for a while during the day, kind of assess your own feelings, say every hour, every couple hours. Okay, on a scale of 1 to 10, how much fear do I have right now? And maybe recording that either on your phone or just in a little notebook. And, then that gives you a little guidance around to like, okay, around whatever it is mid-afternoon, my symptoms are the highest, so that might be another good time to do a grounding activity. So yeah, again, it's different for everyone, but just paying attention to yourself and what you personally need.
Thank you so much, Sarah. This has been amazing and very, very insightful. We appreciate all that you have shared with us. We want to encourage all of our participants again, if maybe you have a question after we end this session, that you please submit them to marfan.org/E3ask. Again, be patient because of the volume of questions that we have coming in. We promise to get back to you as soon as possible. We want to encourage you again to complete the session survey. Remember that we will be showing our appreciation to 3 people who complete the survey by randomly choosing 3 participants for a $50 USD prepaid international debit card. And you must complete your surveys by Wednesday, September 16th at 11 p.m. So please don't forget that. Tomorrow is the last day for our summit. It's hard to believe it's already been 3 weeks. So don't miss the opportunity to connect. Be part of the community, be part of the Marfan family. We're here to support you along your journey. We also ask if you are on social media that you use hashtag E3Summit20 to share your experiences with everyone else. And finally, we ask if you are able to, in order for us to continue to provide this life-saving work, if you can make a donation to the Marfan Foundation, we would greatly appreciate it. Please use marfan.org/donate. We would also like to share with you something that is really exciting for us. So coming up, you're probably wondering after 3 weeks, what are they going to be up to? So coming up after the summit is our Aortic Disease Awareness Week. It is going to be September 19th to the 26th. It's a worldwide event and it's being presented again by the Marfan Foundation. We stay busy and we hope that you will all participate. It's an awareness project. Raising your hand raises awareness of the risk factor for aortic disease. So the information is available on our Summit app and also on our website and on our social media. So please, we would love for you to participate in this Aortic Disease Awareness Week. And before we end, I just want to ask Sarah, do you have any last comments that you want to make to our participants?
Just wanted to say thanks for coming. Thanks for having me. It's been great being able to talk with others about who've been through similar experiences to me, and then also be able to share some ideas and some information about ways that you can get through those stressful experiences. So thankful to the Marfan Foundation for putting this on and for having me. So thank you.
Well, thank you, Sarah. And we're so happy that you're part of our community and we know we'll be able to tap into you at any time. So we're glad to learn from you. We appreciate you sharing your experience and your time with us. And to all our participants, wherever in the world you are, whether it's morning, whether it's afternoon or evening, we want you to have a great one. And don't forget, again, tomorrow's the last day for the summit. So please check us out and also reach out to others who are in the Hoover app. And we look forward to seeing you when we do our awareness week for aortic disease. Thank you so much. Bye-bye.
Bye, thanks.